Is botulinum toxin type A more effective than other prophylactic treatments in reducing the frequency of migraines in individuals with chronic migraine? Migraine headaches are listed as one of the most common causes of disability, affecting 15% of the population worldwide. In order for a migraine condition to be classified as chronic, the patient must experience 15 or more headache days a month for 3 months, and at least 8 or more headache days must be migraine days. Migraine treatments are classified as either abortive or prophylactic. Abortive treatments are meant to treat acute symptoms after the migraine has already started, while prophylactic treatments are used to reduce the frequency and severity of migraine attacks. The purpose of this analysis is to determine whether botulinum toxin type A is more effective than other prophylactic treatments in reducing the frequency of migraines in individuals with chronic migraine. The first review discusses data from 3 studies on the efficacy and safety of botulinum toxin type A in the prophylaxis of migraine headaches. The studies analyzed are the Preempt 1, Preempt 2, and Compel studies. These studies found substantial decrease in monthly headache days for chronic migraine patients when prophylactically treated with botulinum toxin type A. The second study compared the efficacy of botulinum toxin type A and Divalproax, which is an anticonvulsant. Participants were treated with either 125 units of botulinum toxin type A or 200 milligrams of Divalproax for a period of 3 months. Patients experienced relief in all aspects of headache symptoms with the Divalproax treatment. So in this particular study, Divalproax was the more effective treatment. The next study, published in the New England Journal of Medicine, tested the efficacy of frimazumab as compared to placebo as a prophylactic treatment for chronic migraine patients. This is a humanized monoclonal antibody that selectively targets calcitonin gene-related peptide involved in migraine pathophysiology. The final results concluded that even though this was an effective treatment in reducing the average number of migraine days per month, it was less effective than botulinum toxin type A. The next study compared the anticonvulsant topiramate and flunarizine. Flunarizine is a dopamine receptor blocker and serotonin modulator. Participants were treated with flunarizine. The participants that were treated with flunarizine responded at a rate 50% higher than the topiramate patients when comparing the data from the botulinum toxin type A studies. The results from flunarizine are less effective. And the final study investigated the efficacy of a fibromyalgia treatment, milnacipran, and this study investigated the efficacy in reducing headache days in migraine patients, the number of headache days in migraine patients. Milnacipran is classified as a serotonin and norepinephrine reuptake inhibitor, and the analysis of the results did not show any significant improvement for chronic migraine patients in the number of migraine or headache days So it can be concluded that this would not be an appropriate treatment, and botulinum toxin type A would be a more effective prophylactic treatment. When comparing the studies of botulinum toxin type A to the other prophylactic treatments, there wasn't very many direct studies with the same number of participants or the length of the study or the treatment cycles. And so for the first one, the Divalproax, the number of chronic migraine patients was so small, if maybe they were to include a larger population, there would be a better comparison. For the next study, it wasn't a direct comparison to the results from the treatment from botulinum toxin type A. For flunarizine, it was a very short study, so if they were to extend the length of the study, they would get a better picture of the results and the efficacy and safety of that treatment compared to botulinum toxin type A. And the last one, lisinopril, again, the number of chronic migraine participants in the study was much smaller than the botulinum toxin type A studies. So final conclusions after the review, again, botulinum toxin type A is more effective than other prophylactic treatments in reducing the frequency of migraines in individuals with chronic migraine. Traditional prophylactic medications have been found to effectively reduce headache and migraine days. And for some people, that may be a better course of treatment. Obviously, each patient needs to be treated for their particular condition, and that's for the patient and the physician to decide on. As far as additional research, supplementary research comparing prophylactic treatments with a larger sample size of chronic migraine patients, and again, additional studies that would directly compare botulinum toxin type A to each individual prophylactic medication. If there are any questions regarding a specific treatment or study, I would welcome those questions, and references are available. Thank you.